Welcome to Health U. Did you know that you might have been using the wrong criteria to judge whether you're obese? The latest research published in the prestigious medical journal The Lancet has revolutionized our understanding of obesity. Traditional body mass index (BMI) indicators may have incorrectly diagnosed millions as obese, while truly patients requiring treatment have been overlooked. This large-scale study, led by the International Obesity Research Alliance, tracked 54,000 participants from different ethnic backgrounds for 10 years, revealing serious flaws in traditional BMI diagnostic criteria. Principal investigator Professor Francesco Rubino pointed out that BMI is merely a simple ratio of height to weight, completely unable to distinguish between muscle and fat tissue, and ignores the critical impact of fat distribution on health. Let's first understand why BMI can mislead us. A fitness trainer who is 180 centimeters tall and weighs 85 kilograms has a BMI of 26.2, classified as overweight, but his body fat percentage is only 10%, with abundant muscle mass and completely normal metabolic indicators. Conversely, another office worker of the same height weighing 75 kilograms has a BMI of 23.1, which falls within the normal range, but his body fat percentage is as high as 25%, with excessive visceral fat and insulin resistance phenomena already appearing. The new diagnostic criteria, called clinical obesity definition, incorporates 6 key indicators: waist circumference, body fat percentage, visceral fat index, insulin sensitivity, inflammatory markers, and metabolic syndrome-related factors. This comprehensive assessment system can more accurately identify obesity states that truly pose health risks. Waist circumference measurement is one of the core indicators of the new standard. Men with waist circumference exceeding 90 centimeters and women exceed 80 centimeters may be diagnosed with abdominal obesity even if their BMI is within the normal range. This is because abdominal fat, particularly visceral fat, releases large amounts of inflammatory factors, directly affecting insulin function and increasing the risk of diabetes and cardiovascular disease. Body fat percentage measurement is equally important. Using dual-energy X-ray absorptiometry, DEXA, or bioelectrical impedance analysis, BIA, body composition can be accurately assessed. Healthy men should maintain body fat percentage between 10% to 18%, while women should be between 16% to 24%. Exceeding this range may pose metabolic risks even with normal weight. Insulin sensitivity testing is another innovation of the new standard. Through oral glucose tolerance test, OGTT, measuring blood glucose and insulin response curves can detect insulin resistance phenomena early. This test is more sensitive than traditional fasting blood glucose and can identify problems even in the pre-diabetic stage. Inflammatory markers include biomarkers such as C-reactive protein, CRP, and interleukin-6, IL-6. Chronic low-grade inflammation is an important characteristic of obesity, and the elevation of these indicators often appears earlier than weight gain, serving as warning signs of metabolic dysfunction. The research also found that ethnic differences have a significant impact on obesity diagnosis. Asian populations may develop metabolic abnormalities at lower BMI values, while African populations are relatively less prone to insulin resistance. Therefore, the new standard has established individualized diagnostic thresholds for different ethnicities. This transformation has profound implications for clinical practice. Physicians can no longer rely solely on BMI for diagnosis and must conduct more comprehensive metabolic assessments. Treatment plans will also become MEM or personalized, adopting different strategies for different types of obesity states. For muscular overweight individuals, the focus is on maintaining exercise habits and nutritional balance. For visceral fat type obesity, aggressive dietary adjustments and pharmacological intervention are needed. For the general public, this means we need to redefine our understanding of health. The numbers on the scale are no longer the only standard. More importantly, it's about body composition and metabolic health. Regular waist circumference measurements and monitoring blood glucose and lipids are more meaningful than simply controlling weight. Practical health management strategies must also be adjusted accordingly. Aerobic exercise can effectively reduce visceral fat, with 150 minutes of moderate intensity exercise per week being the basic requirement. Resistance training can increase muscle mass and boost basal metabolic rate. In terms of diet, reducing refined sugar and processed food intake, increasing protein proportion, and adopting a Mediterranean diet pattern all help improve metabolic indicators. Sleep quality's impact on metabolic health cannot be ignored. Research shows that sleeping less than 7 hours per night affects leptin and ghrelin secretion, leading to appetite regulation disorders and increasing the risk of visceral fat accumulation. Stress management is equally important. Chronic stress promotes cortisol secretion, leading to increased abdominal fat. Regular stress relief activities, such as meditation and yoga, help maintain a healthy metabolic state. The publication of this research marks the entry of obesity medicine into a new era. Future health management will be more precise, no longer a one-size-fits-all weight control approach, but individualized care based on individual characteristics. Each of us should re-examine our health status, not be bound by traditional BMI values, but focus on metabolic indicators that truly affect health. Remember, a healthy body is not about pursuing extreme thinness, but pursuing optimal body composition and metabolic function. Let's use scientific methods to develop the most suitable health management plan for ourselves.